event. I think thinking on how we're talking a bit about building back better, and how the pandemic has brought this discussion, and really how important to really look at, as you will be doing, the direct ramifications with our responsibilities also to address pre-existing existential challenges such as climate change, environmental degradation, and natural disasters. At Igva in February, and a number of you on the call, members or non-members, have participated on this. We launched a process called Igva 2030, which was to look at what is the added value of a network like Igva in the coming 10 years. We didn't realize it was so timely to have this conversation. What's coming out from there are the push for major evolutions or transformations, looking at the next 10 years of the network, but also aiming at impacting on the sector. It's around being more committed, purposeful, and deliberate in championing principled humanitarian action. That's one. In fostering locally rooted and regionally, globally informed approaches. Third, in demonstrating diversity and inclusion. And fourth, in ensuring the agile and principled partnerships. So as the co-organizers of today's meeting, ADRRN and Igva, but also the co-hosts CWS and OCHA, but certainly we will benefit from the discussions to shape our respective strategies by 2030, but more specifically to understand how we can support members, non-members to navigate in this new normal, and specifically in Asia and Pacific context. So the Regional Humanitarian Partnership event online between now and December with the theme of the future of humanitarian carries this needed momentum to really make our ability to partner as our most strategic capability. And I'm very much looking forward to the exchanges today, and thank you very much for the opportunity of addressing a few words to all of you at the kickoff.
Thanks very much, Ignacio, and for sharing some of the things that are emerging in that 2030 discussion already. Now I'd like to hand over to Ahmad Dixit, who is the chairman of the ADRRN network, to also open and welcome the event. Over to you, Ahmad. Ahmad, are you able to unmute or hear us? I can see you trying.
Please.
Yeah.
I'm being muted all the time. Okay.
We can hear you now, loud and clear. Thanks.
Okay, now, do you hear me?
Loud and clear. Thanks so much.
Well, let me repeat again. I very happily join Ignacio in welcoming everybody to this first of the series of events online, which are envisioned for looking at our own soul searching, looking at our sort of understanding ourselves to define our collective approaches and responsibility towards meeting the overall global targets. Sustainable development and improvement in the livelihood condition, disaster reduction in the Asia Pacific region. We are very proud at ADRRN. We had meetings, and we are very proud that this partnership. We are continuing this partnership over the years. Earlier we did it in face-to-face. Now online with our with OCHA, with Igva, and with CWS, and we look forward to, and with other partners in the region, and also our members, our hubs of ADRRN. This fits well into our own efforts of redefining or operating our strategy for the 2030 targets, and the basic idea is how to adapt to the local, the changing situation, and at the same time, we have learned so much in the last 9 or so months of this pandemic time, that we have so much to say, and there is the need for linking the local realities to the global centers of design and planning, and also budgeting for humanitarian actions. At the same time, educating ourselves about what is happening at the front line and how our members and our, together with others, members or non-members of ADRRN, working at the field table, and what they realize. So in this process, we are to learn and also formulate our ADRRN strategy for the next 10 years. So at this moment, not to repeat many things, I thank colleagues at OCHA and Igva and all member organizations and our ADRRN thematic hubs for active participation, and I look forward to a fruitful deliberation and meeting of minds and learning, especially by our young colleagues. So thank you very much, and over to you, Kia.
Thanks, Ahmad, and thanks both of you for that excellent welcome and putting our mind into the future frame that we're going to now spend the next couple of hours looking at. Before we get into the event, I wanted to just explain a little bit about how the session will run today. The first hour, we will be having a panel discussion with regional colleagues to help set the scene with this topic and with this discussion on what does it mean for the future of humanitarian response. And after that, we're going to be going into a breakout room discussions where participants will be as well able to contribute and take the discussion further, and we'll do a bit more of a deeper dive. So that will be the second hour for today. We request throughout this that people keep microphones muted and cameras only if you're speaking, and then we'll be able to, questions will be coming through the chat box, so you're encouraged to put those in at any time, and we'll have monitoring, and after our panel discussion, we'll be able to get to those. Okay, so to get straight into it and to our panel discussion, I just wanted to introduce the next slide and our esteemed and thought-provoking panelists for today's discussion. Sorry. Great. We have with us Helen Mould, Head of Operations at OCHA's Asia Pacific Regional Office, Takeshi Kamino from Secretary General of the ADRRN Network, Dr. Animesh Kumar, Officer in Charge at the UNDRR Regional Office, Najiba Wazefodost, Founder of the Asia Pacific Network of Refugees, Gwen Pang, Deputy Regional Director of Asia Pacific, IFRC, and Davide Zappa, Acting Head of ECHO Asia Pacific, but normally as well the Disaster Preparedness Lead. So, as humanitarians, we're often used to things being unpredictable, but I think we can all fairly say that 2020 has proven more unpredictable than most years. And something we thought probably earlier in the year would be an event or something that we had to deal with has now turned into a global pandemic and forced us to adapt our ways of working. But even before we were faced with COVID, we in the region were already learning and dealing with ongoing impacts of climate change, multiple hazards and compounding factors, reflecting on where we were with the grand bargain commitments and looking at increase in government-led responses. So, this conversation is coming at a really timely and unique point where we're starting to accept moving forward that even despite positive news of what may or may not happen with vaccines and COVID, we're probably not going to go back to the way we were. And we have this chance now to ask ourselves, what do we want to take forward as we're planning for this next decade for more effective response that puts people at the center and can deal with the complexity of hazards that we're facing. So this is the scene in which we're going to have this panel discussion today. And so without further ado, I'm going to start with the discussion. And our first panelist today is Helen Mould from OCHA. And Helen, I wanted to ask, how do you feel like responses have changed over the last few years, including the role that different actors are playing at different levels? And how do you think this will what do we take away from this for future responses?
Yeah, thanks very much, Kaya, and thanks for having me here today. And it's nice to be in an actual physical space with other colleagues as well, so I'm not just talking into a laptop. Kaya, you mentioned previously about the increase in government-led responses, particularly in the context of COVID, and I think that's the first point that I would like to bring up. Previously, we would speak of the international community providing assistance when a government was overwhelmed due to the scale of a disaster. But I don't think that is now the right way to consider our role as the international community in disaster response. This is partly because governments' capacities to respond to disasters have increased over the years. It's now much more unlikely in this region that the international community would be stepping in when a government is unable to respond. Rather, we are there to augment the government-led response. But I also think it's the wrong way to consider what our added value is as the international community. Whereas before we may have stepped in to fill the gap in the provision of relief items, now even in small and medium scale disasters, I think we can still have a crucial role in supporting the government to deliver a quality response. And so if regional and national actors are working in partnership with governments, then we should be able to provide a substantive role no matter what the size of the disaster. Of course, there is still an important role that the international community plays in delivering relief goods, but we're also able to strengthen the quality of the response by ensuring that it meets the needs of the most vulnerable people to ensure that no one is left behind, and that specific needs related to gender, disability, and other intersectional issues are fully understood and addressed, and that the response proactively addresses protection concerns by seeking to minimize protection risks and also address issues when they arise. Our ability to address these issues and to provide a quality response is only possible if we have a more thorough understanding of the community's needs and if we take a more proactive approach towards engaging communities before, during, and after a disaster. So one other change in disaster response over the last few years has thus been a much stronger emphasis on community engagement and accountability to affected populations, recognizing that we need to shift the power and put communities at the center of our operations. And so we must systematically listen to and respond to communities' feedback about their needs and the impact of our response. I think that NGOs and CSOs have been at the forefront of this work, but there is now a stronger emphasis on interagency approaches to be prioritized to strengthen humanitarian responses. I think this has really gained a strong impetus during COVID-19, given the importance of risk communications and community engagement during the COVID response. But this momentum should be carried through for planning and responding to all disasters by ensuring there's a common understanding of what common platforms will be used to ensure community feedback and concerns are acted upon during a response. One further change in response in the last few years has been the sustained push for localization of disaster responses, as well as the increased role of regional organizations such as ASEAN. Due to COVID-19 and the restrictions around movement internationally, regionally, and also domestically, there's been a further shift with regards to the attention paid to the need for localized responses. Recent responses have, for obvious reasons, prioritized the use of local staff and actors, accelerating into reality discussions that have been ongoing for some time about the need to increase participation of local actors and provide them with the adequate funding resources to operationalize their responses. In addition, because of access challenges and movement challenges posed by COVID, we've seen regional partners playing a remote role, whereas previously we may have been providing in-country assistance, providing technical support to in-country and national partners who are leading the responses. And my final point, just to raise at this stage, is that over the last few years, there's been a lot of discussion around the humanitarian development nexus and the understanding that humanitarian action needs to be linked to ongoing development work. What does this mean in reality? Well, we know that those who are targeted for development programming will likely be those who are most in need and prioritized for humanitarian assistance when there is a disaster. We also know that early action is critical to prevent humanitarian need. This means understanding risks and vulnerabilities and adapting and amending development programming to mitigate those risks, supporting those left behind and providing them with timely support to prevent the slip into humanitarian need. We therefore need to do much more to be monitoring risks, prioritising anticipatory action and early actions, including reprioritisation of development programming and understanding triggers for response. The risk is that if we do nothing, then humanitarian needs will escalate and will become more deeply entrenched, and that development gains will be lost. At the same time, we are seeing that there is now a much swifter move from humanitarian action to early recovery. This means that at the national and regional level, we need to be much swifter with the support that we provide. As the timeframes we are working with are now much shorter, we need to be considering early on how humanitarian programming will shift to early recovery and then into development programming. However, there should also be a consideration of how disasters have affected populations and reevaluate their needs, and understanding what is required across all phases of programming to build resilience to future disasters. I think this is especially important and should be done in the context of COVID-19, due to the increase in the change in humanitarian vulnerabilities, the risks and the needs that this has brought about. Thank you very much.
All right. Thanks very much, Helen, and providing that overview. I think, you've raised a number of points, but that role of that changing shift in the way we're augmenting and complementing government responses and making sure we're reaching the most vulnerable in the response and understanding that vulnerability early on in when we're identifying the risk to be able to take actions, I think is a really key point, and I hope it's something that will come back in the discussions of how do we do that. And you raised the point of localization. So that takes us to our next panelist, Takeshi. And I wanted to ask you, Takeshi, we're hearing that this thing about localization being able to be accelerated because of COVID. It's been able to put that discussion at the forefront. And I wanted to hear from you and from your perspective of your extensive membership and networks and hubs, what trends that have you seen emerge with localization and which ones you think can be sustained and should be sustained moving forward? Over to you, Takeshi.
Thank you, Kea. And Helen, I wish I was in that main room also. I'll be speaking into my computer, as in the case of, I think, many people nowadays. So, with this COVID-19 response, I must say I couldn't be much more prouder of the local actions that our membership have undertaken. And I have 2 points that I want to mention in this panel. The first point is that COVID-19 was a reminder that the localization is essential. So what I mean is that COVID-19 affected different segments of our population differently. The survey that we have administered so far, we are getting good responses, by the way. We hear that the most marginalized who had difficulties accessing assistance prior to COVID-19 are impacted the most. And this COVID-19 response requires localized initiatives on testing, quarantine, treatment, and more importantly, changing behaviors, such as avoiding the 3 C's, the closed space, crowded place, close contacts, and wearing masks and ensuring sanitization, etc. Because of the lockdown situation in many countries, the supply logistics have been adversely affected. Organizations, therefore, had to manage humanitarian assistance remotely, and we were forced to rely on the local organizations and local leaders to carry out the operations. And each community has its own sets of challenges that required the local improvisation. For example, the challenge of tackling 3 C's in the urban slums, double disasters like the cyclone and the pandemic happening at the same time. And from our experience also, when we think about the disaster risk reduction cycle, we also recognize that the majority of the things in the DR cycle are done locally, from identification of hazard risk, planning, mitigation plans, and making sure that these are in the local budget, early evacuation planning, and immediate search and rescue, identifying and assisting the most vulnerable, and ensuring the core identity and dignity in the community during the recovery phase, and preparing for the future disaster risks. So, this COVID-19 was a reminder that localization is essential. Now, my second point is that local leaders, therefore, need to be recognized and supported. We have these disaster risk related science and know-how, good practices from various countries in the region. But these needs to reach those who are ensuring that hazard don't become disasters. Behind every hazard that didn't turn into a disaster, there's a local leader who stood in and saved their community. And for that, NGOs also, I think it needs a transformation in a way that we need to recognize such producer or the support role in making this work. And the regional network like ADRRN, I think it needs to be in place where such sharing and linking to key resources and professionalization can happen. And from what we see so far, local leaders need further knowledge and capacity to carry out their work more effectively. And we believe that networks like ADRRN is in a pretty good place to identify, reach, and enable capacities at the local level. And we know that the engagement with these local leaders, either informal ones or the elected ones, appointed ones, can have exponential outcomes. Given the lockdown, for example, and difficulties in mobilizing persons and materials to the front lines, we had to rely on the local leaders. That was our only option. And local leaders were much more aware of the challenges. They provided us with ears and social listening, and they proved that they can mobilize volunteers from the neighborhood, provide a quick training, and get them to participate. And more importantly, the local leaders could catalyze that partnerships with the government and public health institutions. And in order to allow these movements and initiatives to expand, we would like to see that the funding environment to support such local actions as well. The survey feedbacks that we have so far have also called for less bureaucratic and longer term flexible funding, and that could cater the cascading risk scenario that we're all in today with the true sense of partnership, moving away from the mere risk transfer, etc. So I would stop there, but I just want to also remind people that I will type in the survey link now. We're waiting for more responses to the survey. It's open till December, so if you could also take part in that, that'd be great. So I'll stop there. Kea, back to you.
Thanks, Takeshi. I really liked this statement that you said of like, hazards that didn't turn into disasters, and recognizing the role that local leaders played in that, and in adapting that the standardized responses we were seeing, but the role they played in making sure it was fit for their community purposes, and that we've seen this, but the need to elevate and continue to support those networks to grow, whatever they may look like, and understanding them. And I think, so staying in that disaster risk management space, I want to turn over to Animesh from UNDRR. And I wanted to ask you, what are the trends, recent trends, and including COVID-19, what they've revealed about the gaps you've seen in disaster risk governance, and what do you think needs to be prioritised moving forward? Over to you, Animesh.
Thanks, Kea, and thanks everyone. It's very nice to see so many familiar faces, both on the panel as well as among the participants. I would start from where actually Amoji left on the SDGs. So this consultation is actually happening at a very opportune time, not only because COVID has posed new challenges to the humanitarian world, but also because of the time we are in. The year 2020 marks 5 years of implementation of a series of international frameworks that were adopted during 2015-16. Giving us a very good opportunity to look back at these 5 years to draw lessons, and then look towards the remaining 10 years till 2030 to define what the Secretary General has called as the decade of action. Now, when the global frameworks were adopted 5 years back, including Sendai framework, the SDGs, the Paris Agreement, and subsequently the Agenda for Humanity, the New Urban Agenda, the people needing humanitarian assistance was less than 100 million globally. By now, this number has increased by two-thirds, and by 2022, it's expected to increase to 200 million. That's twice the number of people in need than in 2015. At the same time, humanitarian funding remains insufficient, and you people know much more than I do in terms of meeting the growing needs. And the gap between requirement and availability continues to grow. And this is complemented by some changing humanitarian realities and complicated by intensifying disaster trends, more frequent events, the growing reality of systemic and interconnected and cascading risk, and the compounded impact of disasters as we have seen this year, posing a challenge to equity, poverty, risk nexus, all being fundamental development challenges contributing to vulnerability, and all of it being underscored by risk drivers like climate change, environmental degradation, and unplanned urbanization and population growth. All of it being complicated now by COVID-19. Now, if we look at the SDGs, at best, we are actually talking about unsustainable development rather than sustainable development. And there appears to be a race between disaster risk and development. In an ideal world, we would want disaster risk and development to run in opposite direction, and we want development to win the race. But that's actually not happening. And in many cases, we have seen that disaster risk is overtaking development processes and posing a serious challenge to the development gains that countries have painstakingly attained over the last several years. So if we then put it all together, and if I then look forward towards the time to come, I would like to offer 3 key points as priorities from my side in terms of moving forward. The first one is in context of strengthening the humanitarian development peace nexus or collaboration. So very strongly promote and operationalize the nexus approach. And experiences have shown that disaster risk reduction lies at the center of this triangle and becomes a very good basis of this triangular approach. Humanitarian program cycle is actually being used as a framework to organize different DRR entry points. This also requires us to invest in durable solutions, especially in context of the displaced populations, and ensure that humanitarian actions, as outlined in the HRPs, are screened for risk. For example, ensuring that where relevant humanitarian actions address and mitigate risks. A recent study has shown that the climate adaptation efforts are not prioritized as a part of humanitarian response. For instance, a very small fraction of projects included in interagency appeals have a climate change component, and less than half of these receive funding. That is a pointer number 1. The second is in context of data. We cannot solve a problem unless we know what the problem is about. A right data tells us when to assist, who to assist, and what to assist with. The contextualization of early warning, and not just early warning and turning into late warning at times, is another very good attribution to data. And this then in turn informs anticipatory actions. And my final point is in context of resilience. Resilience is the common objective, whether it's disaster risk reduction, development, or humanitarian actions. Now, since the Hyogo framework era, much of the attention has been on preparedness and response, which, whilst probably accounting for considerable reduction in disaster-related mortality, has not been able to tackle the underlying risk drivers. Hence, as we move deep into Sendai era, while humanitarian actions in several contexts would remain an imperative, we should also pay more attention towards the ex-ante side of things to prevent a risk, as was called earlier, from turning from risk to disaster or a crisis or an emergency. I would end here, but I would like to highlight that COVID recovery process does offer us an opportunity to revisit our current way of working and look towards a more resilient future. This is one issue that we would definitely want to highlight at the upcoming Asia Pacific Ministerial Conference on Disaster Risk Reduction that will be organized next year. And I look forward to receiving very grounded feedback from organizations being represented here. Thanks a lot. Back to you, Kia.
Thanks very much, Animesh, and thanks for bringing those points in, right, about the other frameworks that this is complementing we need to think about with humanitarian response, and not thinking just in that preparedness space, as you were saying, of the DRR, but moving as well in the development and understanding these risks again earlier on, and looking at that nexus and the different roles in being able to prevent and mitigate risk, which I think something we'll be able to hopefully come back to as well. I want to switch to another key population in humanitarian response, refugees. And we have very lucky to have Najeeba, who's been an advocate for refugee self-representation and leadership. And Najeeba, wanted to ask you about the role refugees have been playing in recent responses, including in COVID-19, and what you think we should learn from this for the future of humanitarian responses.
Thank you very much, Kaya. And again, thank you for ICVA for hosting this event and also for having me as one of the speakers. I mean, what I could say clearly is that we've seen the refugee community that has shown great capacity in solving issues around migration and integration. We've seen refugees that are often acting as the first responders and the last responders, refugees that have basically acted as integration guides for newcomers and governments. We've also seen refugees acting as program implementers and educators. However, I need to say that refugee-led solutions are not growing, or neither it's expanding and replicating fast enough. And that's again due to lack of three things: lack of access, information, and funding. And that's something that we have realized within this pandemic. We all know that COVID itself has been adding a lot of insecurity and vulnerability to refugee communities in many parts of the Asia region. And within the Asia Pacific Network of Refugees, we've had a lot of dialogues and consultations with these communities where they have reported to us about the additional risks that they have been facing at this particular time. And some of those challenges goes back to because that they have very fewer resources to deal with the economic impacts of lockdown. And we just heard about it just a few weeks ago when we were having a consultation with 21 refugee-led organizations in Cox's Bazar in Bangladesh. We also have been hearing from the community that they still have, or they don't have freedom or the privilege to move and practice physical distancing, which we often tend to use it as a precaution in developed countries. A lot of them have been also voicing out around the lack of access to medical services. And again, when we talk about strengthening national health response plans, how do we make sure that we don't leave anyone behind? And most often when we talk to refugees, we hear from the stateless, we hear from undocumented refugees that they're not necessarily included within the system that responds to their health issues, including COVID. And many also have talked about the less or the lack of access to government services and support. However, I mean, with all of the challenges that I've been basically mentioning, we've seen that COVID-19 was one clear example which refugees have turned it from a crisis into an opportunity. And they have quickly acted to fill in the gaps and responded to the needs facing refugee communities, particularly when at times a lot of us from the developed countries or international actors were restricted to basically from traveling, or many were opted to work from home. It was the local grassroots organizations, refugee-led initiatives that really took on, the effective and innovative and impactful resources to ensure that their needs were met, the communities' needs were met. Today, again, we see refugees stepping up to support each other at their local communities as frontline responders to COVID-19. And again, in regions like Asia Pacific region, in the Asia Pacific Network of Refugees, ACNUR, a network which basically consists of 12, which operates across 12 countries with refugee-led initiatives in the Asia region. And we've been able to provide, support to each other through different means. And some of those included providing medical care. For example, 500 produced masks to undocumented refugees to Iran. We were able to produce health information to refugees in Thai-Burma border in Karen language. We were able to provide material and financial support to vulnerable refugee women and girls in terms of the sanitization packages. Or we were able to provide educational support by connecting and linking the diaspora with refugee communities at times where refugee children were forced to leave education or to leave the refugee-led learning centers in Malaysia and Indonesia, for instance, and ensuring that their education was still continuing, even though there was lack of support. And at the same time, we've continued our leadership and advocacy to ensure that the national health system included all refugees again. What we basically have learned from all of this is that meaningful inclusion really requires resources and investment. And as I said before, until now, we've seen most refugee-led activities and entities have been self-supported. What we hear continuously from refugees and what we've been always discussing is that we want to be continuously engaged in policy discussion in order to bring our expertise at all our different at all level, not only at local and national level, but also to the regional and international level. We want to make sure that our different critical stories from the ground to international decision makers are reached. And to connect to those affected by policies, to the shapers of those policies, And what we've heard and what we've discussed during the pandemic and what we have realized is that we want a participation revolution. And what I mean by that is that we want a human-centered design approach to refugee policymaking. And without a space for these stories and our experiences, no policy discussion will be as meaningful as refugees need them to be. Refugee-led organizations are uniquely positioned, and the COVID-19 was a clear example again in terms of how they can be seen as equal actors, as co-developers to the solution. And we are hoping that we could work with governments, NGOs, and private sector and other stakeholders to make refugee participation meaningful. We really hope that the future solution will adapt in realigning existing resources to support initiatives that promote meaningful inclusion by refugees, and recognizing that there's a considerable capacity within refugee communities, which not only increase refugee self-reliance, but also contribute to durable solutions and improve integration. I'll leave it there, Kaya. Thank you.
Thanks, Najib. And I think you made that point really articulately about the added value and the importance of meaningful participation of refugee voices in that policy discussion. They're leading it on the ground, they're self-supporting the initiatives, but making sure, and this is something Helena touched on before about participation and making sure that is going up the chain and at all different levels to be part and shaping the policy discussion. It's that nothing for us without us. So thank you for highlighting that point. We're going to go over now to Gwen from IFRC. And, Najiba touched on this point about, apart from COVID has also had these restrictions on movement, and which has affected the way we would normally do things. And so I wanted to ask around community accountability and the way that's been challenged with the COVID restrictions. And from these challenges, what you see that we can take forward to shape the future of community accountability. Over to you, Gwen.
Thank you, Kaya, and good morning, good afternoon, good evening to all partners, colleagues, and friends. And thanks to Igva for inviting the IFRC to this meeting and for the opportunity to speak. Kaya, you raised a very important questions. CEA, or we call it the Community Engagement and Accountability, is an integral part of our work, especially during the COVID-19 operation. We have put a lot of attention and emphasis on this. And I'm very happy to hear that this was also mentioned. The importance of this was mentioned by Helen in her intervention earlier. And I will respond to your questions in two parts. First, the challenges in community accountability approaches. And the second is how we take the lessons forward. So on your first question on challenges and how we have addressed them, the IFRC network in Asia Pacific comprises of 38 national Red Cross and Red Crescent societies with a total of 128 local branches and 20 million volunteers. In the early days of COVID-19, when information on the nature of the pandemic or disease had not emerged yet, especially how it is transmitted, who are at most risk, and how the transmission chain can be broken, so on and so forth, the number of volunteers venturing out to determine the unique needs of each community and to listen to community concern has reduced. Because in most Asia and the Pacific, as you know, interaction between and among people is very much part of our lives. COVID-19 brought a sudden and massive disruption on how we engage not only at the institutional level, but also at the individual level. In this backdrop, however, ensuring effective community engagement and accountability, or I will refer this as CEA, is non-optional even in times of physical distancing. Fortunately, we were not starting from zero. Had gained significant, as I've said, we're not starting from zero. We had gained significant experience in ensuring effective CA during the disease outbreaks. In IFRC network, we have played a crucial role, especially during the West Africa Ebola virus disease outbreak. In fact, building on to this experience on the Ebola virus outbreak experience or response, in December of 2019, just before the COVID-19 pandemic or the outbreak, the Red Cross Red Crescent Council of Delegates adopted a resolution on Red Cross Red Crescent movement-wide commitments to CEA. So the so how did we do it? Number one, or how did we meet the challenge, or how did we face the challenge? Number one, the IFRC network had to adapt quickly. We have to make a quick shift because effective CA enables different groups of people to share their insights, to ask questions, or to clarify expectations, to share and obtain accurate, relevant, and potentially life-saving information, to influence the quality and effectiveness of our programs, and most importantly, to hold us to account. Number two, in addressing these challenges that you have mentioned, especially on the restriction on COVID-19, we have to innovate. We have to innovate our approach to CEA in restrictions related to COVID-19. So number one, by investing in risk communication. This is in order for the community members to know the symptoms of COVID-19, what preventions measure they have to take, what to do if they suspect someone is infected, where to look for accurate information, how to deal with rumors, misinformation, or infodemics, and etc. Number two, under innovation is we have used social media and digital platforms. Then third one, we did, we use traditional media such as radio and TV, and were applicable, because in some countries they're really into social media already. So, but we are using traditional media such as radio and TV, as I've said, and then we have also engaged the media practitioners to give accurate information, especially in addressing rumors. So number four, we have equipped our volunteers. We have equipped our volunteers, especially those who undertake community visit and supporting frontline efforts. This is to ensure that they are COVID-19 safe in terms of engaging with the community. So we have provided PPEs, and we also conducted training on how to ensure their own safety and that of the community that they interact with. And the fifth one that we did is working with other actors at the global, regional, national, local levels. This is in order to build synergies, to avoid duplication, to share ideas, how to ensure that humanitarian network adapts collectively. So we have done a lot of work, say, with the interagency. In fact, the IFRC has to co-chair the interagency sub-working group on risk communication and community engagement. So those are the ways how we counter the challenges. Now let me go to your second question, which is what lessons we learned and how to take this forward. As mentioned earlier, we have a network of 128 branches all over the world, and then also 20 million volunteers. These branches are in the communities that we support, and our volunteers, 20 million volunteers are actually part of the community that we are supporting. So there is an inherent connection between accountability from the partner and accountability from the community itself. So in the very specific lessons that we want to take on is that number one is localization. It is important to walk the talk on localization down to the community level by increasing investment in and strengthening local capabilities. That investment produces the ability to operate locally, even when other organizational layers are compromised. We are regarding local branches and communities as leaders and equal partners in humanitarian action. This goes to the heart of our national society development agenda. Number two lessons that we would like to share is the design of our operation. The design of our operation, the IFRC network was able to scale up its COVID-19 responses in all the 38 countries of Asia Pacific and globally 162 countries without international deployments, because its design is based on national and local capacity more than international capacity. The third lesson that we would like to share is invest in digitalization. Lessons from COVID-19 are a stimulus to us to invest into more digital feedback loops. especially on external verification, that may not be possible. Although video testimonies, smartphone satisfaction surveys, and others are all possible, but the braver step, I think, that we would, if we agree that all communities could feedback on a sort of like humanitarian trip advisor. So that could, this will allow us to see all the, the feedback from the communities that we serve as a humanitarian network. So there's a huge risk on this, I know, but people are trying to work out these risks or those risks. So for instance, some have been using the Loop application or the LOOP. So this is a good example where users are asked, were given a chance to, ask questions, and also they get opinions from their friends, networks, and the public. So I think we should be brave enough to welcome those risks. So number 4 is with the donors on CEA. I think number 4 is to work with donors on CEA. To work with donors on CEA, we have to, have a dialogue or discuss with donors on what form of community accountability they would accept as assurance of high quality of work. For too long, too much emphasis has been placed on accountability focusing on financial risks. Now, if donors place equal emphasis on community feedback organizations, this would incentivize the organizations to invest more in, CA as part of, or as integral part of their work. So we have a lot of examples to give. Some are on our websites, and we're very open to sharing many of the lessons that we have learned and also the examples of the actual work that we have done in different countries. So please feel free to connect with us. To end, let me share that the demand in our Red Cross Red Crescent movement for community engagement and accountability has increased steadily. And indeed, we should by all means make sure that this becomes a standard in all parts of our humanitarian response work. Thank you very much, Kaya. Over to you.
Thanks very much, Gwen. I like the messages of building on what we know, but also being innovative and not being afraid to be innovative, and understanding the need to reconceptualize not some of just the methods we use, but also the way we perceive community accountability and the role it plays in making sure our responses are effective. Now, last but not least, and I think I want to turn to Davide from ECHO and ask you, Davide, from your perspective, what are the humanitarian trends you're seeing in the region that you think are going to have most impact on humanitarian funding moving forward? Over to you, Davide.
Good afternoon, Kaya, and good afternoon, colleagues, and thank you for the opportunity to share some thoughts with you today. To answer your question, let me briefly frame some of the challenges ahead of us so that I can better try to expand on some of the priorities we see to address them. We know that humanitarian needs are at an all-time high and they are ever increasing. This is why, and because crises are more complex, more frequent, and last longer, they are driven by conflict, population growth, fragility, and climate change. Persons of concern are facing increasing barriers in accessing services, while humanitarian actors encounter obstacles in delivering assistance. We know that humanitarian funding cannot keep pace. This is despite it is constantly growing. As we have already discussed today, we know that our region ranks amongst the most natural hazard prone in the world, and we are all familiar with the 2020 Informed Risk Index, for example. Certainly, COVID-19 has further compounded pre-existing vulnerabilities of many in the geographies we are working in particularly for those depending on remittances and from the informal sector. We also know the needs are concentrated in fragile and conflict-affected situations and in protracted context. About 50% of the world's poorest currently live in FCAS, and this is forecasted to increase. in this picture, despite their economic and technological dynamism, several Asian countries and subnational regions remain caught in protracted cycles of conflict and violence, which contribute to underdevelopment and fragility. These are not only large-scale regional crises. I'm thinking of Afghanistan or the Rohingya crisis, but it is also about forgotten crises, the DPRK, Mindanao, and many other hotspots that you can think of in our region. Moreover, as other colleagues have pointed out earlier today, Asia is also marked by migration movements within the region and out of the region. And this means complex mixed migration flows, including asylum seekers, stateless persons, and people displaced by conflict and or by disasters. The point that I'm trying to make is that what is common in these situations are systematic violations of international humanitarian law, international human rights law, and international refugee law. This consequently result in deep impact of the communities caught up in them. So what can we do about this complex and difficult background? We think that it is even more imperative for humanitarian actors to understand the interaction between the intervention and the context, so to avoid negative consequences. Our colleagues have mentioned already the buzzword Nexus. This is not only part of promoting and operationalizing it, so to say, increasing in coherence and complementarity in our responses to crisis, but it is first and foremost part of a do no harm response analysis from our perspective. This is about promoting the respect for international legal frameworks as an integral part of our operations, as well as advocacy in country and regional fora in Asia Pacific. Our approach is always to put people at the center of what we do, leveraging instruments we make to reinforce local preparedness and response capacity, whenever possible, working at system level. So very briefly, how does this look like? For example, during COVID-19, we have seen that a very dramatic spotlight has been put on how much gender-based violence and violence against children is widespread. But at the same time, this remains pervasively underreported in both conflict and in sudden onset natural hazard crises. The accelerating environmental change and climate risk further exacerbate tension and generate new fault lines for conflict and violence against children. Going ahead, we think we must be more anticipatory in our approach to better prepare and so that we can act ahead of shocks and crisis deterioration. At the same time, through a stronger focus on preparedness and anticipation whenever possible, we must concurrently continue to respond alongside to acute and severe needs as they manifest. Let me conclude on a positive note. Some early but encouraging evidence of what I've just been talking about is emerging. But let us be clear that the devil is in the detail. We must continue focusing on what works and what doesn't. Collectively, we need to do better in this critical dimension. And as the ECHO, we stand ready to work with our partners in further defining this in the region and elsewhere. Thank you.
Thanks very much, David. And you raised and introduced, some of the new risks and challenges we hadn't touched upon, including around GBV and the increase that we saw. Obviously, the other drivers of remembering in our region as well about conflict and the protracted nature of crisis. And I think you hit home a point that we came back to earlier about we need to be anticipating risks and having contextual approaches and understanding that. So thank you. With that, we've concluded our panel discussion. I want to say thank you so much for all those on the panel to contribute. We're going to now quickly check around the Q&A to see if there's anything people want to raise.
Yes, so we have one question from Fatima Yamin, who's a manager program development disaster expert. Her question is for Ms. Najiba and Mrs. Gwen, which is how much has misinformation and disinformation regarding COVID been challenging in delivering COVID-related humanitarian work? And what was your organization's strategy in dealing with misinformation? a very topical question in an era where truth is having many challenges. So maybe over to first Gwen and then Igva.
Thank you very much. So what we did in terms of handling misinformation or or handling rumors or infodemics. So we have effective way of sharing information, a transparent and effective sharing information. Like for instance, in Nepal Red Cross Society, so they have set up quickly the Facebook group amongst all the volunteers. So then that's a closed group amongst all the volunteers, wherein informations are funneled there, given to the volunteers on how on correct informations about COVID-19, how they can protect themselves, even donning of masks, everything that they have to know. And then we also did our briefing, conducting of training, explain the code of conduct and everything through that platform. And then through there, our volunteers actually are also sharing what they have learned or this information to their own social media site. So it's trickling, effect from our volunteers through the community people, including their own family members and their community. And then on the also we did a perception survey. So we did a perception survey together with the interagency of the interagency like WHO, OCHA, and UNICEF. And this perception survey were translated into 13 languages. Of course, very important for you to know if you have, if there are misinformation and whatever, they have to understand your questions and surveys as well. So then we did also the, we have translated the survey into different languages. And there were a lot of misconceptions that came out from the survey, and then we used that as a way to that feedback was very good, because that gives us the opportunity to design our communications to correct the miscommunication. For instance, like an example of some respondents. I will not mention the countries. So there were several countries that were in this survey. So some believe that people have the foreigners who visit the country have COVID-19, and then that they may not be following government orders, or they have insufficient related measures in terms of traveling. There's not enough quarantine. So there's so many information about that. And then also not just about misinformation. Through this platform, we're also able to understand what are the worries and fears of the of the people. And then we found out that many are fear of losing their loved ones. Many have fear of getting sick. It's about 73% of the respondents responded that way. And then also some actually show significant emotional and mental stress because of the challenges that they're facing in COVID-19. So this actually help us in designing our response, in giving in our response. We acknowledge that in our response, we have to integrate and put psychosocial support to the people. And then we also have, through this survey and respondent in one country, wherein 84,000 people were supported, because it also helped us in designing our response. As I've said, they mentioned that they will need help for disinfection spray in their community. So because of that, then because of that feedback from the community, so we integrated the disinfection spray in the community, and that actually added to our COVID-19 response. So we get the feedback from them and then correct the misinformation, and also use the feedback from them in designing or in crafting or developing further our response to the different communities. But of course, the design is different. It depends on what feedback we get from the community. Thank you.
Thanks very much, Gwen. And over to you, Igva, to add.
Yeah, and the only quick comment that I can add to what Swen has already said is that most often refugees have referred to information as a way of communicating, appropriately and most importantly in a timely manner. I think that's what's been specifically highlighted throughout our consultation and community dialogues. Refugees most often refer to information as communication, and they see that as an aid itself. Especially at times of COVID-19, it was very crucial for the communities to receive information in a timely manner. But what we've seen as a challenge is that at times when we were quite busy in basically finding out what language translation is required, how do we deliver information, most of the communities were not necessarily being provided with the right, for example, information flyer or information precaution materials. We remember when we started speaking to refugees at Thai-Burma border, they were receiving all the information in Burmese language while they actually wanted information in Karen language, and that's exactly what they required. However, because of the pandemic restrictions, there was lack of consultation with the communities on the ground, and most often we weren't able to not only provide information in a timely manner, but at the same time we didn't provide what accurately was needed on the ground. So I think being able to have effective communication with people is so important. Increasing that two-way communication is so important as well. I think Ms. Wen said it really well. Most often we realize that when we have lack of communication, it leads to much more anxiety and fear within the community, especially in response to COVID-19. So I would say, it's very, very important. We have gone through challenges in terms of misinformation, creating more anxiety and fear in terms of isolation and quarantine measures and so on, where it has put the community in greater risks of not disclosing whether they have COVID or not. But what we can do in humanitarian emergencies is that we insist that both refugees and aid agencies to make two-way communication and see that as a way and see communication as aid. I'll leave it there.
Questions? Oh, sorry. Two more questions, but we'll keep these questions and we'll be able to either explore them in the chats, but also put them to panelists afterwards. So
yeah, so we have one question for Davide, and I've lost the text here in my chat, so I'm paraphrasing a little bit. But with COVID-19, we've seen kind of everything come together into sort of one big mega disaster where everything becomes linked. And how do you see, what is your approach to making sure that pre-existing disaster affected communities and the most vulnerable are not lost as we have this global pandemic that's affecting so many more people?
Over to you, Davide.
Yes, thanks. I guess that in terms of providing an answer, I would, generally the way in which we understand preparedness is that preparedness applies to any type of crisis. And therefore, this includes any type of risk. And obviously, in this region, this is a lot about natural hazards, as conflicts and violence, as we discussed before, but also epidemics. And in days of COVID-19, this is very much relevant to us. So, ultimately, this is about needs-based approach and promoting needs-based approach that consistently integrate risk analysis. And I think that, from that perspective, that it certainly as ECHO, as a humanitarian donor, we are very clear about maintaining this focus. So I don't necessarily see, the risk or the concern that is being highlighted, but I appreciate that, obviously it needs to be taken very much in the forefront of all these discussions. So thank you for the reminder. Over.
Thanks. And I think for our last question for Helen, question from Vanda Lenkon from Plan International. With the risk appetite in Asia Pacific, how do you see the challenge of moving forward both with COVID-19 and with the sort of climate crisis that we're seeing with the repeated typhoons moving through these areas, the increase in flooding. How do we see the collaboration between agencies, donors, and agencies to move beyond the nexus and promote the voice of vulnerable groups, considering these compound crises? A real easy question to end up on.
Thank you very much, Sander.
A solution.
Sure. I mean, I think I'm just reflecting on La Nina, which we know is a risk for this year and is something that we already have on the horizon in the context of COVID, and sort of reflecting on where we should be heading towards, given that is upcoming. And I think the focus needs to be on, as other participants have mentioned, on risk analysis, on anticipatory action, and on early actions, and having a common understanding of those through all partners, but having that being grounded in feedback and communication and engagement, which is meaningful with communities. And I think, that was another question in the box as well, how to ensure meaningful community engagement. And I think that's really key. I think this isn't just about receiving information and analysis passively from communities, but acting upon the information that they provide us with, whether that is information about risk within their community, disaster risk, how that can be mitigated, how resilience can be built upon, or whether that is feedback from communities during a response with regards to what their needs are, how the response can be improved, and how we can do better for them. I think, there is no easy solution, and I'm not going to pretend that I know the answer, but I think that we have to bear that in mind, that we should not just be passive recipients of information, but that we should be looking to integrate what we receive from communities within our contingency planning, within our early action planning, within our forecasting for responses, and within the responses themselves. Over.
Thanks very much, Helen. I think in the interest of time, because we really do want to hear from all participants and take this conversation further, we're going to move straight into the breakout rooms, but we do encourage, if any panelists do want to join them, please stay on the line. And we'll be able to continue that discussion. And like I said, we're keeping track of the questions, which will feed into the documentation that's happening. So thank you very much. And I'm going to hand over to Takeshi, who's going to explain how the breakout rooms are going to work. So again, thank you to all our panelists. Over to you, Takeshi.
Great. Thank you very much, Kea, and for all the panelists, and for all the participants for your questions as well. Can we forward one slide? Now, this is really a time for us to hear from you. And sorry, it indicates 40 minutes, but I think we're pushing a little bit, so we'll make it 35 minutes for the group discussions. Now, everyone, you'll be assigned to one of the discussion groups automatically, and there will be a pre-assigned question and a facilitator in the group. And after the group discussion, we will ask few groups to report back at the plenary. For all the facilitators, please don't forget to record your group discussion. You need to press that button to record. And we want your contribution also in each of these groups, and please volunteer to be a note taker. We're using this tool called Ideas Board, which it will be explained by the facilitator. It's very easy to use. You just have to click on the link, and then you can put inputs, your ideas, even if you're not talking. So I hope that is clear. Anything I missed? Any of the organizers? Nope. So then, have a great discussion, people. You'll be now moving into the groups.
She said,
I'm going to sit in another room to do this.
oh, yes.
you guys in the main room are physically moving, but we will be virtually moving. Is it working?
Yeah, we're working on moving everyone.
Cool, thanks.
Time for a quick drink of water.
Please hang on a minute. We'll work out the technicalities.
Maybe while we're all waiting to move, one of the questions when we come back from the breakout room discussions is going to be, we're going to ask everyone, you know, if you had one message for the humanitarian sector, what would it be? And so you'll be able to put that in the chat box when we come back in plenary. So just to plant that seed now for you to have a think about that question.
One facilitate.
Hello. Let's hang on a minute for people to join. I think they're now shifting people. Can you hear me okay?
Hello.
Hey, hey. You back from Nepal, right?
Yes.
Right. Thanks for joining.
Thank you.
Hello, I'm Asma from Pakistan. Hope everyone is fine.
Hello. Thank you. I am fine. How about you?
I'm good, thank you so much.
Great. Great. We got Surya-san also from Nepal.
Hi, Takeshi.
Hey, good
Good
to see you.
afternoon.
How are you doing?
I'm good. How are you?
Very good, very good. Oh.
So good, good. Congratulations for this great event.
Well, there are some technical issues, but yeah, I'm glad people have turned up, and it's a great time to catch up.
Oh yeah. So Takeshi, you have been in Bangkok or in Japan?
I'm in Japan. You know,
In
with this
Japan.
COVID-19, I haven't been out of my city since February.
Oh,
Never been
good
so
for you.
confined.
Good for you. Maybe being at home.
Well, more time with family for sure.
Yeah.
Yeah. But I haven't been so confined since my student days, you know.
That's good. That's good.
I'm sure it's the same for all of you.
Yeah.
Yeah, but this COVID has given us an opportunity to spend more time with our families. Let's see a positive side as well.
Indeed, yeah. I
Yeah,
absolutely
we are
agree.
spending a more time with our kids, our family, and of course our parents. And of course, we are giving the time to the nature to just restore. You know, every morning you just breathe out, you feel the fresh air because no car fuels, no smoke, no peoples, and no, of course,
Right.
peep-pops of horns. So we
Indeed.
better see the positive side as well because that's the life, that's the nature. Yeah.
Right. No, absolutely. Where in Pakistan are you based?
In Islamabad.
Islamabad, right. Okay.
In
Yeah,
Islamabad.
indeed.
I've been in Peshawar as well. Have you been in Pakistan?
Yes, I was based in Pakistan for a while. I was in Islamabad. I was in also Karachi for a while. Yeah, so I used to work in both Kabul and Islamabad, half and half when I was based in your region.
That's good. You must have an idea about the Islamabad. In these days, we have a very cold winter over here, and the COVID second phase is pretty strong over here. So the government is thinking about again they shut down the schools in the next week. They have not declared the final decision yet, but parents and the communities they are forcing they have to shut down the schools, especially the junior and preschools, because the situation is getting worse over here. Yeah, people here are not very much interested in the second phase. They are not taking it very seriously. They're enjoying their weddings and everything. So government is now thinking about to take the serious actions against that.
I see. Yeah, it's a tough time for all. We have Van. Is that okay?
Hi, I'm Nicole Van Rooyen. I work for the ICRC. I'm based in Geneva, but I'm the protection head of sector for the Asia Pacific region.
Okay,
So
Nicole.
I'm joining as an observer, but
Great.
very happy to be here.
Thank you. Thank you for being with us. And Ping, is that right?
Yes, my message to the humanitarian sector is that leadership and participation are essential and worth exploring in COVID-19 response impact quality of larger communities. So try to consider community-led response.
I absolutely agree with you. And when we get back to plenary, can you write that again? I think they will be asking you to all comment on the chat box.
Yes.
What's our
Yes,
key
I will do.
message? So I think that's an excellent message. By the way, colleagues, can you see this URL in the chat box? This
Yeah.
one? Yeah.
Yes.
Can you
Yeah.
click on it? What we want you to do, when you click on it, you will see this screen, right? Let me also share this screen. So this is the screen that you see, right? And when you click on this green button, and it gives you this, Post-it sticker, and then you just click on it and you just write on it like test. And if you like it, then you can click on this like button. You can also delete it. You know, it's easy to use. So I would like to suggest that, you know, although we will engage in this discussion, but if you could also jot down your ideas here for the record. We will capture all your ideas and it will be reflected in the policy paper that a few consultants will be working on. So your cooperation will be appreciated. Is that okay?
Yeah,
That's
a great idea. Thank you.
Great.
I guess a question, do we need to write here something?
Yes, so you know, we can start this conversation, but then please also ensure that you note your ideas down on this whiteboard as much as you can, because that will be for the record. That will be the record of this discussion. Now, the key question that we want to have a conversation on in this group is this one. So how can we uphold shared values and principles for effective humanitarian response in this new normal? Now, some questions, follow-on questions could be that, do we really have a shared values or principles? And if yes, then what are they? And what do we need to do about them, with them, to make our humanitarian assistance more effective? So, any ideas, guys?
Is there any such defined values and principles, Takeshi, or do we need to define it?
Well,
probably somewhere in some form.
Think about what you've heard also in the panel as well. You know, things like grand bargain, localization, quality accountability, community engagement, resilience, human-centered design, participation revolution, and all that you have heard, right? Some of these, I must say, are not really shared values or shared principles yet. Some people are talking about it, but I don't think we really have it shared as a sector. But you know, so these things.
And I mean, I was just thinking, I mean, this question of this effective humanitarian response is also very much important. I mean, we talk about humanitarian response, and the qualifier here, the effective, is also very important. How do we define this effective response is also very important, I think.
Well, that's a good question. So what kind of assistance is the effective response from your perspective? I mean, you guys went through that Nepal earthquake recently. What's your experience? So yeah.
Yeah. Question to me?
Yeah. Question to you. So what, from your perspective, what is the effective humanitarian response?
I mean, it can have many dimensions, perhaps, but for me, one of the dimension is timely response, and I mean, another dimension is local solutions. I mean, one solution may not fit everywhere, so can have local solutions. Cost effectiveness, likewise, and also another response, perhaps the use of local responders or local community volunteers. That's another perhaps effective response. These are some of the important attributes, I think, but there can be many, I think.
Yeah, no, thanks for that. So truly a locally led response. So the localization, for example, you would uphold quite importantly. Yeah.
I was thinking on the localization, Takeshi. Perhaps this may be my little knowledge. I have been referring to so many other documents regarding localization on humanitarian response. But one of the important point I see is, I mean, much has been talked and much will be talked. But if there is any indicators and target-based localization effort, I mean, indicator and target may be different for different levels. I mean, for UN system or UNDRR, it can be different, but for governments, it can be different, and for international NGOs, it can be different, and for local community organizations, it can be different. So I was thinking if there is indicators and target-based localization for different actors, that can be very important, I think. I mean, there are different attributes of localization, but so far I haven't seen this targets and indicator-based response, localization of the humanitarian response.
I think that's a really good point. When we put numbers to these indicators, sometimes we become very tokenistic. You know, let's include one person from the local community because then we can tick off this indicator on localization, for example. I think we need to be it needs to be a multi-sectoral sort of effort to come up with these indicators, but the shared indicators on localization, I think, is what you're saying, right?
Yeah, and can be different at different levels. I mean, from UN or UNDRR's perspective, it can be entirely different than from the community perspective.
Absolutely. Thanks. Yeah, Asma, you have your hand up.
Yeah, thank you so much. That was a very good question. And when I just look at my experience in humanitarian sector, like in earthquake, in flood, and right now in the COVID, and as already mentioned over here, when we are talking about the response, I mean humanitarian response and their impacts, basically coordination made a very effective efforts over here. And I'm talking about the local plus government level coordination. I mean the area where the disaster has been happens and the area where the government is working, that should be coordinated on the one page. And the utilization of youth, the community, the local people is very important because they know the geographical location, they know the climate situation over there, their weather situation over there. That's very important. And before making any strategy, when being a UN person, whenever we do the assessment, I mean the need based and the real assessment, we really counts these points on a red light. And of course the localization and especially the utilization of opportunity linked with the international laws are very important. And I've seen that, as you already mentioned, that the multi-sectoral integration is very important. For example, we are working for community restoration. It cannot be done without the integration of course, the WASH, of course, the child protection sector, protection sector, and we cannot work the other themes as well. So when I'm looking at the response and how we get the opportunities, it's very important that the multi-sectoral approach should be there, and we should not forget the do no harm policy. That's very important, because when we are working within the border side and out of the border, the localization, their integrity and their norms are very important, and one should not cross that. These are my points which I would like to add, and I really would like to add more, but I want to listen to my other colleagues' experience and their ideas. Thank you.
Thank you. You're very polite. I have a follow-on question to what you have said, if I may. You said the coordination with the local community and the local government is going very well in where you work. What do you think is the factor that contributed that it's going very well this time?
Is this question to me?
Yeah, yeah.
Oh, well, I'm sorry, I didn't say it went very well. I said it's very important,
Okay.
because
Right. Okay.
Early stages, you know very well, every time it's not a piece of cake. Never ever, because there are the positive and the negative sides. Sometimes we are not going to coordinate with someone if we do not have the negotiation skills. That's very important. So it's not a piece of cake for humanitarian sector, but we have to handle it, because we have to complete the response, we have to cater the community over there, and we have to take over the disaster, because one have to live, and we have to restore their lives and their livelihoods especially.
Right. So when we think about in the people-centered way, and that's probably the principle that we need to adhere. Vivek, you have your hand up.
Yes, Takashi-san, thank you. Adding to what Surya sir and also Asma was talking about, I think it is evident that the localization and identifying the local leaders is extremely important moving on to the new normal age, especially when it comes to effective humanitarian response. And I think in addition to any response being effective, things like effective program design or using the right tools. I think the main key comes down to identifying the local leaders when it comes to localization. So usually in Nepal, we have these micro level local groups called community improvement committees. That are not these official bodies registered to the ward levels, but these very small bodies that the community come up with themselves. So I think even going down to the most grassroots level, if we can mobilize people from those committees, who are very familiar with the problems that are rooted in the society, then it would be very effective. So going down to the very roots of the community, it would be very useful for any type of humanitarian efforts to be designed and also to be implemented, most importantly, I think.
Excellent. Thank you for that. Do you see any challenges when you go into this really grassroots level, community leaders, community committees, when you try to engage with them? I know you guys are really good at that at NCET, but I just wonder, what are some of the difficulties or challenges that people may face?
Yeah, it can be a challenge most of the times, because you need a lot of time to identify who the really effective leaders who really listens to the people who knows the real problems of the society, or even the true beneficiaries, especially when it comes to things like COVID response. When you have to decide who are the real beneficiaries of the response that you have designed, especially in the emergency situation. So yeah, it may be challenging to identify the effective leaders. So you may need a lot of time to decide that. Yes, that may be a challenge.
Thank you. Thank you.
Takeshi, one more point from my side, Takeshi.
Yes.
Usually, I'm talking about the engagement with the national governments, actually, which is a very important part. Usually what we see during humanitarian response is national governments are more focused on generalization of the response because they need to address big group of people, large number of people in case of large disasters, and national governments have to have common solutions for that's fit for everyone. That's why national governments are more concerned on generating the common solutions, whereas there are definitely certain specifics uh, in the specific communities, and those specifics need special attention, which is perhaps normally missing. And in those cases, the local organizations, the local NGOs, CBOs can address better. But because of these common solutions, as well as the specificities of the communities, there are always some kind of tensions between the governments and also the local actors. So I think one of the important player being the government organizations, a lot of advocacy engagement has to be done systematically from the humanitarian organizations such as the network organizations such as the ADRRN and several other national organizations. I think this is also another important factor or important issue to be considered, I think.
Absolutely, very good point. From Japan also, we face the same. So the government focus on more of a fairness, principle of fairness. So, we have, say, 6 people in this group. If I have only 3 cups of tea, I'm not going to distribute any because it's going to be unfair. And then civil society people will say, no, this person requires fluid more than this person. They understand these, but sometimes there is a tension. And I think one way of overcoming that is for both sides to recognize that we are partners and we have one common purpose, is to serve this population in the best way possible. When local government achieve that with the civil society organizations in their own area, they work very well. And I've seen some good cases from Japan that they have worked extensively well because they have that mutual recognition that you are required and I am required and he's required, she's required for this common big purpose. So someone needs to have that sort of vision of getting people together, I think. But excellent point. Asma, you have your hand up.
Thank you so much. I'm just listening to very good points shared by my colleagues over here. I do have one more thing to share over here about the challenge. I would like to add one example in Pakistan. Like when we have the first phase of COVID, like in early June, where our government has declared the lockdown and everything. The real challenge which we faced over here, the government, is the daily wages. How they're going to cater the daily wages, because in Pakistan there is a 60% people are under poverty line, so government have to cater them. And the other challenge was, if they're going to cater them, how will be the accountability part could be served over here. So the government has initiated, of course, they target the beneficiaries through their ID cards. I mean, there is one institute in Pakistan named NADRA, the National Institute of Data about all the population over here. And then through that, they just did the assessment, how much the daily wages are over here and how much we pay them to just they could survive within this 3 to 4 months. Then the government calculated the amount, and then here they added the media. the social media, I mean the television, the radio, the Facebook, and through Facebook, through television, government had started the small advertisement that they will receive the SMS, and then they have to be informed through SMS where they should come and collect their money, because people are also receiving the fake SMS, and sometime other people then get their money instead of the real beneficiary. So again, now they use the biometric machines, so the real person going to get their money. The main values which I really would like to add over here, that the awareness part in people, that the COVID is here and what they're going to do, and the seriousness, because people are not at all serious about that. They are just thinking about this is the drama of the government. Please forgive me if someone just heard that the new phenomena, because they are not taking that it's a life risk. They are taking it that the government is making the drama, they would like to take the funds and blah blah blah. But the thing is that the government at the end, through social media, created that awareness, build the capacity building, door to door, and cater the real beneficiaries through their SAS program, and cater the daily wages, and accountability part was also there. So I would like to add that the real challenge was that to build the capacity of people, that how they should support their responding team, which are coming to serve them, which are there to serve them. Because as a humanitarian person, we also face that challenge, that mostly communities are which are facing the disaster, they are not very much supportive, because they are in a trauma, they are in a disaster, they lost their loved ones, of course their logistics, their home which they created, I think after a lot of dreams. And for resolving all that issues, being humanitarian a person, we have to be very patient as well, because the government has shown their patience, and they listened to their communities, and after the assessment they just come up with a plan which really works in Pakistan, which really works. And now government is again taking an initiative in the second phase. They are not going to do the lockdown, but they have a strict rules about the social distance, about the wearing mask, about the fine if you're not wearing the mask. So these are the points I also would like to add. Thank you.
Thank you very much. Excellent point. I was in Pakistan actually in February, and after that I was in India, and then I came back to Japan the end of February. At that time, people weren't talking about COVID. They thought it's a problem in China, and in the transit when I was wearing a mask, people look at me and say, thinking that this guy is probably from China. He has COVID. But then this whole phenomenon this year has made me realize that COVID, the risk is definitely there. But then people have lots of risks around them. COVID is not the only risk, right? So the daily wagers, for example, if they can't work, they can't put food on the table. Then if you get a COVID-19, probably your mortality rate, depending on your age and preconditions, but let's say it's 5% mortality rate. So you have a 5% chance of dying from COVID-19. If you can't put food on the table, then that risk may be higher and higher for these households as compared to contracting COVID-19. So what I really learned over this months this year is that risk is relative, and we need to recognize that. We can't force people to think in the way that we do, for example, So I think your point is right on. I don't know in other countries. I think we have colleagues from Philippines as well. I'm not sure if where our colleague from Geneva is from, but if you guys have things to add from your perspective, your locations, that'll be appreciated. Or maybe you're not there. Okay, and thanks guys for writing your ideas on the notes as well. It's really great. The first post-it here, it says stories and voices of communities along with their lessons learned as part of the community of practice should be considered in decision-making for response intervention. Is this from Ping? Okay, maybe he's not there. Let's see. Now, considering some of the barriers that we have discussed between this focus of the national government as well as more of a community-centered approach, what are the initiatives that you think you can undertake, for example, Syria and Nepal, to overcome these tensions, you think?
Here the role of like I see, the local governments is extremely important. This may be applicable in any case, but particular to Nepal, this is very much relevant because the bridge between the national governments and the local community is the local governments, but they also have problems because they need to comply with the national government's rules, regulations, and directives. But at the same time, they can make adjustments for responding to the local situation. One thing is the local governments. Likewise, the importance of the importance of national NGOs and also the other actors at the central level who have actually the ground level presence or understanding is also very important. For example, at the national level, organization like NSET, who has a deep understanding of local context, such as the organization like several UN organizations who have the deep presence and understanding of the local context, they can serve as a kind of a facilitator for bringing the local context, local knowledge to the national governments also. So role of national organizations and other international organizations is also extremely important in this case. So as you know, NSET has been organizing a lot of national advocacy events. For example, the National Earthquake Safety Day, where we organize awareness campaign, where we organize the symposium meetings, etc. Are for those purpose. One of the purpose is to address this gap. So there can be many other, like I see, these are some elements to bridge the gap.
Excellent. Yes, critical role that you play for sure. Thank you. Asma, you have your hand up.
Yeah. Thank you so much. Let me add an example from Pakistan over here. Of course, as mentioned, the local government, the localization empowerment is very much important. Here in Pakistan, the national government has created a one youth-based force. They named it Tiger Force in a COVID response, that the youth has been involved for the coordination and for the support with the government and with the local communities to come up with the problem they have faced, the lesson learned they have faced, and shared with their local authorities. And further, step by step, the local authorities with the national authorities, they have come up with the solution. And of course, recently we have received one letter from the National Humanitarian Sector where they have requested the UNRC in Pakistan to just again resume the collaboration and the coordination with the INGOs and NGOs sectors in Pakistan to just cater the second phase of COVID in Pakistan. So the UN and the national government has given them a green signal. Then again, they are very much interested to work with the INGOs and NGOs together to just again face and stand up against this COVID situation. So the government over here has taken a very good initiatives, like they are utilizing the youth, they are utilizing the government communities, and not even the local communities, even the communities based and created at a street level. They are very much have information what is going on, and they are also just giving information and the lesson learned, especially because these lesson learned are very important for us for decision making and for the strategy development.
We're ending in 8 seconds.
Okay, thank you so much. Thank you.
So thank you guys for your wonderful
Thank you
inputs.
very much.
We'll go back now to plenary.